Good evening, good to have you with us in this edition of the Urban Debate. We begin with the spotlight on the economy and the big announcements made by the central government today. The finance minister came out with a series of measures, 8 big measures across different categories, and the government hopes that this is going to provide economic relief to all the sectors that have been, specifically those that have been badly hit by COVID and the second wave. Let me just broadly take you through some of the highlights here. 50,000 crore loan guarantee has been announced for health infrastructure in non-metros. Essentially, there will be guarantees given for anybody looking to take loan, either for expansion of their existing infrastructure or even creation of new infrastructure. 60,000 crore loan guarantee has also been now announced for other sectors. About 1.5 lakh crore more funds have been put across for emergency credit guarantee scheme that has now been announced. There is also a scheme that has been announced for the small borrowers. 25 lakh small borrowers can now avail this credit guarantee for borrowing more money, especially through the microfinance companies. Now, this essentially will be for those smaller businesses, individuals running small little businesses who have struggled really hard through last year and then this year's second wave. The businesses are almost dead. For them to sustain, to continue functioning in some or the other manner, this will be a scheme that enables them to borrow more money. 100% loan guarantee to tourist guides to restart business, no processing charge or additional collateral required there. In fact, to boost the tourism sector, first 5 lakh tourist visas will be issued free of charge. Then there is the Atmanirbhar Bharat Rozgar Yojana that's been extended in terms of job creation, so that incentivizes job creation. This has now been extended till March 2022. One of the interesting parts is the 23,000 odd crore rupees that has been now announced for public health infrastructure, and there is a bit of a focus there on pediatric care. Remember, much conversation has happened about children and their vulnerability and exposure now to COVID, since more and more adults have either got COVID or are now getting vaccinated. And as individual states also begin building up the pediatric healthcare infrastructure, this is what the central government has announced. 88,000 crore boost to the export insurance cover, and a lot more that we will, over the next 1 hour take you through. So the focus is largely on health, public health and healthcare infrastructure, pediatric healthcare, also on reviving travel and tourism and helping the companies there. Much has been announced there as well. Some of the existing schemes have been extended and more loan related schemes have been announced for the MSME segment. So let's talk about these announcements. Let's talk about how much can they help, whether enabling people to borrow more in easier ways is really the way to go forward. Will a higher budget for healthcare or even the employment scheme help us at this point of time? We say good evening to Professor Santosh Mehrotra, Senior Economist, joining us this evening, Madan Sabnavis, Chief Economist at Care Ratings, Subhash Goyal, Chairman for the Stick Travel Group, Mukesh Mohan Gupta, President for MSME India, Abantika Ghosh, Health Editor at The Print and author of Billions Under Lockdown, the inside story of India's fight against COVID. Good evening to all of you. Let me just start off with the industry representatives that we have this evening. And Mr. Subhash Goyal, let's begin with you. To what extent can the announcements that were made today help your sector?
I think it is too late and too little. Only good thing which I see, which is the silver lining in the dark clouds, are the free visas, the 5 lakh free visas till 2022. But what is the use of announcing the visas if you're not announcing a date for the e-tourist visa? And, if you really want to revive the economy, that one, you have to announce the date for the e-tourist visas. And secondly, you have to announce the date for starting scheduled international flights. If people take visas and there are no flights, then how will they come? So it has to be simultaneously. You have to announce the dates. You have to announce that at least from those countries with which you have an air bubble, scheduled international flight should start. Without that, it's good. I welcome, I thank the Prime Minister, I thank the Finance Minister. At least finally, they have thought of tourism when 10 million people are jobless today in the tourism industry. and a lot of people have died. You know, now we are going through this crisis. So my suggestion is that if you are interested in giving loans, give grants. How will a tourist guide who's dependent only on foreign tourists, right? From where will he have the money to repay and at what interest? He doesn't have a job for the last 1.5 years. If it was not for gurdwaras and other institutions, people would have died of hunger. So you see, there is a big crisis. Thank God they have realized it. Government has finally realized it. By my humble submission is that at least 1 lakh rupees per recognized tourist guide you give. We had asked for 2.5 lakhs. Give something. And then, we are paying the insurance for the last 20 years, 30 years, 40 years, depending on how old the company is. So at least that insurance money, that provident fund money, you give 50% of the salaries. You have the balance sheet of all the companies. You give in the tourist sector salaries of the employees. If you want to give loans, then the loans should be soft loans at 2% or 3%, maximum 4%. How will the people, when there is no business, repay those loans? So, giving loans is an eyewash. You see, what needs to be done if the government is serious, like governments all over the world, UK, Europe, France, Germany, Italy, all these countries who have suffered, Spain, even Singapore, even all these, they have paid, at least the staff employees or ex gratia grants. Do something. Well, only good thing I see is that, neither the date for SEIS has been announced, right? It is long overdue. People have already spent that money. So I think, I hope that the government is serious and
so let me ask you this before I move ahead. I think what is very clear, Mr. Goel, last time around and this time around as well, is that the government isn't going out in terms of directly handing the money to anybody. They're either coming out with cheaper loans or facilitating more loans and giving more loan guarantees. You're saying that now is too late for that?
No, a lot of people have already, gone bankrupt or left the jobs, number one.
Yeah.
Number two, the interest on the loan is so high. You have to match the world. We are competing with the whole world in tourism. So the interest on the loan should be not, and it should be deferred at least for 1 year. There should be no interest, and then the interest should not be more than 3 or 4%. And for tourist guides and tourist transport drivers who are dependent only on foreign tourists, you have to give them some ex gratia grant. There is so much money going around. Visas, it's good you have done 5 lakh rupees free, but at least out of that money, even if you make it nominal, then you see those people who are already issued visas, who had valid visas, when the lockdown was imposed, those visas should be extended automatically. So plus a date for these visas has to be announced. Without announcing the dates for e-tourist visas, without announcing the dates for scheduled international flights, I think this is an eyewash.
Yes, and one has to ask the question that how many at this point, when we are still getting warnings from the government that the second wave is far from over and having conversations about third wave, will these tourist visas really help? Who's applying for that? Okay, that's one sector. I also want to bring in the other big sector that was also mentioned today, which is the MSME sector. Mr. Gupta, good evening to you. The schemes that have been announced for MSME, would you agree, are also too little, too late? Because we've heard so many stories of smaller businesses, smaller shops, people with 5 employees, 10 employees who've completely run out of cash, who have absolutely no business that's happened for the last 1 year and are, really don't know what to do next.
See, I suppose the government is doing their best, in fact, whatever they can do. But if we demand that you credit the amount of accounts, government has their limitation, and ultimately what will happen? If at all the government will transfer the amount to the bank accounts of these small enterprises, they will imposed a lot of new taxes. So it will be, collecting the taxes and giving it to some others. So I feel that in last COVID wave also, we have seen that, many announcements were done as and when required. And we have seen that the economy has, kick-started again. Suddenly that second wave came, in fact, so it has already again impacted us. But we have seen the GST collection, the direct tax collection, everything was going on the right direction. What happens? There are certain sectors which have been impacted a lot. There are certain sectors which may be, doing even better than what they were doing before COVID. So the MSMEs which have digitally transformed themselves are, most of them are not having. There are other problems like, is in the commodities, but the government, I am satisfied that government is trying to give as incentives or the schemes as are required. And I am confident that when some new things will be required, when the new demands will be required from the MSME sector, perhaps the government will come again. There are demand for the moratorium, but we have seen in past, out of 3 lakh crore rupees, only 2.69 lakh crore rupees have been utilized by MSMEs. What does it mean? To me, it's mean that MSMEs are very much vigilant. They know that they don't require loan at this time, because most of them feel that, taking loan at this time is will again create or will increase their problems in times to come. MSMEs are very much vigilant. They do their due diligence and then only they take the loan. So and it is good thing. Many of time, people ask me, what is this? Why the loan has been not utilized fully? Full 3 lakh crore rupees. I always say because our MSMEs are uh, very ethical, and they don't want to take that. It's a government money, because government is guaranteeing, so you take it and you don't refund it. So I feel,
But
and
essentially,
more.
you're saying, Mr. Gupta, no, there aren't going to be too many takers for these loans from the sector itself, and we will have to look at, other ways. Perhaps, they don't even need to put in too much money for extension right now if the business isn't up and about. Let me now get in the economists, and then we will go to the health part as well. But to you, Mr. Madan Sabnavis, we've had conversations earlier. We've spoken about what needs to be done. Largely there's been an agreement that government needs to spend money. I didn't hear too much of that, barring maybe healthcare today as well.
The way I look at it, Tanvi, is that this entire relief package is in three parts. See, one part is being done through the credit route, and I think what the other speakers were talking about makes a lot of sense.
Because one thing to say that I'm guaranteeing loans, but we need to see what is the absorptive capacity of the economy. Okay, so if nobody's going to borrow just because I'm getting a guarantee, nobody's going to borrow just because I'm getting it at 7.5% or 8%. So unless there is demand in the economy, I know that there is a future for my production of my good or my service. Only then am I going to borrow. So that's one of the reasons when we saw that out of the 3 lakh crores, I think the SMEs took around 2 lakh crores. And then the government extended it to saying that the 26 sectors which were there for one-time restructuring, tourism sector, you added other sectors, and you have come to this number of 2.69 lakh. Now, today I feel that even in case you have this additional 1.5 lakh crores, there may not be much demand for it. Banks themselves are a bit cautious about lending. There is a lot of cherry picking which is going on. So this entire business of giving this credit guarantee is a very good move, but I'm not quite sure as to how many people are going to take it. Simply, if you're looking at the travel or the tourism sector, it is true if nobody is coming to the country, there are lots of restrictions for me staying in Mumbai, going to even Panchgani. I'm not allowed to go there without an RT-PCR report. So I think the tourism sector taking hold of these loans may not really mean anything unless the sectors are opened up. And I don't see that happening anytime soon. People are talking about the third wave. The second part of the package, I think, should be interpreted in terms of giving direct relief to the so-called vulnerable sections. So we have this free food being given. Maybe there is something being given in terms of fertilizer subsidy, and they're looking at something in terms of the health sector. Now, an interesting thing about the health sector, Tanvi, is that even the RBI earlier said that they're giving 50,000 crores to banks so that they can borrow at the repo rate and lend it to the health sector. If you look at the overall outstanding credit to the drugs and pharma industry, it's 50,000 crores. So I don't know where is the absorptive capacity, who's going to borrow. Of course, there could be hospitals borrowing. And I say that these hospitals have to be in non-metro cities. Am I going to set up a big establishment in, say, a rural area, in a village or a small town, merely because I'm getting funds at a competitive rate? I'm not quite sure about it. And I think the third part, I think, which the government likes to do is bring in a number of medium-term to long-term reforms. If I'm talking of the power sector, I'm talking of the PLI scheme, we're talking of exports. I think that's not going to happen anytime soon. It will happen over a period of time. So I think what is missing here is anything on the demand side, and this has been a revealed ideology of the government that they provide an enabling environment for enterprise to function. But I don't think the government is willing, as the other gentleman has said, that we had cash transfers taking place last year. The government chose not to do it. I don't say it's a right or a wrong move, but they had an opportunity. But I think the revealed ideology is that we create an environment rather than giving freebies to everyone.
So, Professor Mehrotra, then let's talk about that. The government's repeated insistence that we are going to always be an enabler. We will create the environment for you. We will, facilitate the loans for you. We will even become the guarantors for those loans. But we won't hand out the straight money, and we won't go overboard with expenditure, for various other reasons. Is there an argument in that favor? Has it worked so far?
Is there an argument in favor of cash handout, cash transfer?
No,
is that your question?
In favor of what the government seems to be doing, which is to say, okay, take more loans, take more loans.
Well, I have data from a survey which was revealed just 3-4 days ago by the Consortium of Indian MSME Associations, and it tells us the following, that 88% of the respondents of the 80,000 plus were yet to avail of any of the stimulus packages introduced by the government of India. That tells you what the reality is. So clearly, there's not much demand for loans, as Madan Sabnavis rightly pointed out, and I think as others have also pointed out. And government has systematically refused to undertake cash transfers other than the 1,500 rupees that it did in over 3 months last year. And this is a serious problem. Now, it's not good enough for us to compare our stimulus with the stimulus provided by developed countries. They're much richer. Their capacity as a proportion of GDP to provide stimulus is much, much greater. But we should be comparing ourselves. After all, we call ourselves the third largest economy in the world, in PPP terms, and we are supposedly the fastest growing large economy in the world till at least a year ago. Then surely we should be comparing ourselves to the emerging market economies. And what did the emerging market economies put in place last year? Well, they put in place a fiscal stimulus, that means spending and expenditure, and tax cuts of the order of 4.7% of GDP. And what did we put in place? 2.2% of GDP. The government doesn't want to spend. It didn't spend last year. It is not willing to spend this year, but it's willing to give cash transfer to PM Kisan. Well, just for 10,000 crore per annum more, you can give a similar cash transfer of 500 rupees a month to about 60% of the population. I've already shared a paper on this subject with Dr. Rajiv Kumar, the Vice Chairman of the Niti Aayog. I wish they would listen. The vast and the design of what the rollout could be or should be is actually there as well. This would revive demand. There's just no question about it that this is neoliberal policy run riot. No question. I mean, let me pick up this health issue before Abantika comes in. Let me tell you what the health allocations have been over the last several years. On the National Health Mission, which is the largest central government program, there was a slight increase between 16-17 and 17-18. Since then, for the last 3 years, health expenditure has been flat in nominal terms. That means in real terms, it has actually fallen. Last year, we got just an allocation of 15,000 crores. And we've now just got an allocation of 23,000 crores. The actual financial allocation for the health ministry in budget 21-22 is lower than last year in a once in a century crisis, if you exclude obviously the pandemic. So all the talk about 137% increase in health expenditure that took place in the budget was hogwash for the following reason, that they had included water and sanitation. Water and sanitation has a separate line item in the budget. So now you've got 23,000 crores coming in, which is certainly to be welcomed, no question about it. But it's barely 0.25% addition of the budget of total expenditure by central and state on health. The government spends only 1.29% of GDP on health. This is a health crisis.
Right.
You need to upgrade health infrastructure to add human resources. Yes, some of this 23,000 crores is going towards that. But this is Band-Aid in the health sector as well.
I was going to ask you, but you already answered that part of the big announcement of 2.2 lakh crore rupees, as the government put it, for their health budget, including many verticals, like you said, including sanitization and water. But if you really chop it down to actual health, it was far lesser. Now, Abantika, to bring in the 23,000 crore for, and it's being called as a short-term emergency preparedness allocation with a special focus on pediatric. How do you see this benefiting us in the current environment?
One of the other panelists used the phrase "too little, too late" for tourism, I think, and that is what comes to one's mind, because see, a lot of what I was about to say on this allocation, Professor Mehrotra has already said. But I just want to add one thing. See, when you talk about pediatric infrastructure, the most important thing that you're talking about is people, human resources, doctors. Where are your pediatric intensivists? You can't possibly train them overnight. And I'm not sure, there's this plan of skilling MBBS interns and all. I'm not sure how that works because, as we kept hearing in the vaccine conversation, children are not small adults. You need specialists to treat them, to see them, apart, even ventilators would need a different kind of fittings to be used for kids. And let's face it, if we are looking at a third wave, then kids definitely are your completely unvaccinated lot, and they are 40% of Indian population. So there is a problem we are looking at, and I'm not sure we have the doctors for that. We have the preparedness for that. And, the fact that we are starting to prepare for it at the fag end of a virulent second wave, that is a problem, because as the second wave showed us, see, another conversation that we keep hearing is that kids may not may not have a tendency to get serious disease, but the second wave showed us that even if we don't, lack of medical preparedness can cause many more deaths when people do not get the healthcare that they deserve. And right now, if the estimates for a quote-unquote third wave vary from 6 to 8 weeks to 3 to 4 months. Is that really sufficient to get your infrastructure in place? I'm not sure at all. Also, again, going by past precedent of what happened in this year's budget, I'm just hoping that even this, when they talk about health sector allocation, I'm just hoping this doesn't include another set of peripheral sectors as health and do the same kind of jugglery of numbers that this year's budget did. Because in terms of if you and there's another thing. Whenever all these years, whenever we have spoken about increasing health allocation, we have heard the health ministry tell us time and time again that states are not prepared to absorb this hike. How is it that now states are prepared. What have we done? I would like to know what have we done to get them to that level of preparedness to absorb hikes now. That is also a question that needs to be answered.
Interesting that you raise that point, and maybe at some point we get clarity from the center on it. But just before I go back to our other panelists, 50,000 crores has also been, set aside for creation of infrastructure and guarantees there for 50% for expansion and the rest for new projects as well. Now, outside of other sectors, Avantika, health is actually a sector which has done a lot of business in the last 1.5 years, whether it's the hospitals, whether it's the pharmaceutical companies, the drug manufacturers. Do you see at least this part helping there, like Madan was pointing out, maybe to create more hospitals in non-metro cities?
But then again, the same question comes. Where are your doctors? Hospitals are not brick and mortar buildings with some beds. You need doctors, healthcare workers, and also see your health infrastructure. If you're talking about expansion, where you really need to probably expand is rural areas. Where is your scheme to get doctors to go to those areas? There are some serious questions. And we have a long-term plan of increasing doctors, but that is over many number of years, increasing MBBS seats, increasing doctors, and we are envisaging a situation where there will be so many doctors, there won't be enough jobs in urban areas, they'll go to rural areas. But unfortunately, we have not reached there. Even if this money makes you erect brick and mortar buildings and get some of the beds and equipments in place, do we really have the doctors to run it? Will doctors go there? That is the question. If we have 3 months, let's say even if we have the rest of this year to prepare, what kind of preparation? Are we again talking about COVID care centers and makeshift places? I don't think that will work. And I'm not sure we have the doctors to man these places really.
Yes, and that is something, while it is mentioned that, this will be funding within the 23,000 crore, they have said this is funding for short-term HR augmentation through, medical students and nursing students. One needs to see to what extent that really helps us if you give them a crash course and get them on the ground. But, in the light of the fact that there is no other option to meet our immediate needs, perhaps that is what governments will have to look at.
But they also have to be willing. You can't force them.
Fair. Yes, fair, absolutely fair. And I think a lot of them have already been absorbed into the system as well. Okay, let's get to the other point. Professor Malhotra, you wanted to come in on this?
Yeah, on the health issue itself, it's very important to appreciate the points that, Avantika has been making. And I would just like to elaborate very briefly. You see, what the government is not willing to take cognizance of is the following, that this wave can be distinguished from the previous wave in having spread to the rural areas in a very vicious manner. And the weaknesses of the health infrastructure and health human resources in our rural areas, especially in the northern states, was completely exposed. Why shouldn't the government be allocating much greater public resources towards that? What is the point of, giving loans for 50,000 crores to the private sector? Because only the private sector is going to take these loans. They may expand in the tier 2, 3, 4 cities. What about the rural area? That's where the testing was not happening. Why do you think our virologists and epidemiologists have been saying that our actual number of cases is a good 5 times and our number of deaths is a good 5 times what is being told to us? And why is that? Because we don't do any testing in the rural areas. And there is such vaccine hesitancy growing in the rural areas that you have to make sure that, you are doing outreach of the proper kind. That needs to be the focus. I don't see where this focus in this new stimulus. It seems as though no lessons seem to have been learned from the viciousness of the second wave. I mean, it's just unbelievable what we are seeing, the callousness towards the health sector.
A sector which has been repeatedly year after year after year, ignored. One would have hoped that when it comes to an experience like the pandemic and an experience like the second wave that we've seen, a lot more is announced. Maybe in the full-fledged budget, at some point they come up with a stronger, more concrete plan. Mr. Goyal wants to come in as well. Go ahead, please.
Well, as far as the health is concerned, prevention is better than cure. You see, last time we allowed the Kumbh Mela, that's why rural areas got suffered. Now we are allowing the 4th Dham Yatra. And secondly, why aren't we enforcing? You see, the people who are going around with without masks, they should be very heavily fined. And maybe like in many countries, they can be imprisoned. Unless and until we coordinate all our efforts, the left hand should know what the right hand is doing. And you see, all these loans and everything is meaningless if we don't restart the economy. You see, to restart the economy, you have to announce the dates of the flights, as I mentioned earlier, and the dates for at least those who have been vaccinated twice. Give them visas immediately, open the country. Many of our neighboring countries have already opened up. You know, most of the Eastern Europe has opened up. Russia has opened up. All these countries have opened up. Singapore is opening. Thailand, Malaysia, Middle East is going to reopen. So why can't we reopen at least for those people who have been vaccinated twice? Otherwise, what is the use of all these, vaccination cards and all this? People have been traveling to Africa with yellow fever vaccine. So why can't they travel to India? Those who have been vaccinated, now more than 300 million people have been vaccinated in India. I'm very proud as an Indian that we are the fastest and the largest vaccine producing country, and also the largest, fastest being vaccinated. But if we don't take advantage of it economically to restart the economy, and tourism is one industry which has a multiplier effect on everything. Why don't they make hygiene and public health compulsory in schools? This was recommended when I was president of the Delhi University Student Union by the Kothari Commission. Up till now, nothing has happened. We do a lot of jugglery, a lot of lip service, and we don't give deadlines. Unless and until we try to give deadlines that, okay, this date, the e-tourist visa will start. And then 5 lakhs will be free. That's understandable. On this date, the international flights will, so that people who are planning abroad can plan. Otherwise, it's an eyewash. It's just good to hear and good for news. That's it.
Okay, when the smallest of the restaurants to the big hotel chains seem to be shutting down as they give up on fighting and figuring out ways to find money to sustain, to pay their employees, then is there a point to come out with these kind of announcements? Mr. Sabnavis, do you want to come in here? What has been addressed in the travel and tourism sector, could we have waited until we have more clarity on when we will begin to open up to those things?
Yes.
Actually, Tanvi, I think I would like to look a bit positively at the package. I think we are spreading too much of negativity because there are obviously a plethora of things which the government can do. There are lots of problems which are there. We may not have had this particular package and all of us would have been happy criticizing everything. But let's look at this particular package in a positive manner. I'm not being a spokesman for the government. Neither do I believe that this package will take care of most of the problems. But I think a lot of effort has been put in within the ideology in terms of managing the fiscal deficit in place. So therefore, we're talking of this credit enhancement. Now, if tourism was not included and they included, let's say, hotels and restaurants, then we would have said, why is the tourism not being included? We should know that there are certain limitations to what the government can do and what a package can do. And remember one thing that I think the FM, to be fair to her, she has started off by saying it's a relief package. She has not called it a stimulus package. So therefore, while we would like to have a stimulus, she's called it a relief package. We are trying to help certain sectors. It cannot be all-encompassing. It definitely does not solve the problem of the tourism industry because, as the gentleman was saying, if people are not allowed to move out, there's no point in having the package. But I think to the extent that something is being done, I think we need to appreciate that the government has done something. Not to say it's solving a problem or it's going to increase the GDP growth or it's going to alleviate the situation. Like saying that opening up facilities for hospitals to be set up in non-metro cities, I think it's a good move. Now, whether it's going to work out or not over 5 years or 10 years, it's anyone's guess. To say that doctors are not there is a genuine problem. But I think a particular package cannot be expected to take care of everything in education, everything in what we call in the medical area, everything in tourism, hotels, aviation. I think lots of segments have been affected on account of the lockdown. So I think we should look at it from that perspective.
Okay.
If the government has done something, it's not going to solve all the problems. Maybe the impact on growth is going to be very much limited, but let's take it at face value. That's the way I would look at it.
Okay, let's try and look at this in another way, and there will always be, people who will be unhappy with what comes, but at one point, there is only so much that can be announced. Because you're making a point to, and Subhash Goel was saying something earlier, I'll allow him to rebut, and then I will go across to Professor Mehrotra and then Mukesh Gupta. Yes.
This is a disaster management situation. People are dying of hunger. And you're talking about, no, this is not our principle to hand out loans. I mean, when people are dying, what are you doing? We are under a disaster management act. So government has to think out of the box. You can't have red tape and bureaucratic thinking. You see, you have to really coordinate your efforts. We have to prevent this third wave from coming, and we have to open up the economy. Otherwise, more people are going to die of economic starvation than will die of COVID-19. I can give you to you in writing if we don't open up the economy. We are suffocating the economy.
Okay, so let me say, add to what Mr. Sabnavis was saying and take it to Professor Mehrotra. The government seems to have said, okay, we are targeting health, we are targeting MSMEs, we are targeting travel and tourism. We have something, on the welfare side in terms of the welfare schemes being extended, job creation scheme being enabled with more money. We've come up with some announcements for the farmers as well, and subsidy on the fertilizers front. So we are trying to cover a little bit of all while sticking to our ideology that we will not give straight handouts on a larger scale, at least to the industry. We can only be an enabler. Professor Mehrotra, why not, then give that plan a chance?
Well, we gave it a chance for the last 15 months, and look where we are. I thought that should be an answer itself. Honestly, I don't see why that question should even be asked, because we know, and this government ought to know, that at the end of 2019, joblessness was already at a historic high in our country, at a 45-year high. And my estimate is that prior to 2020, the absolute number of the poor had risen because joblessness was growing and real wages had been stagnant between 2013 and 2019. Can you imagine what the impact of COVID has been? That numbers of the poor would have increased, the incidence of poverty has increased. I'm about to publish an estimate of what the numbers of the poor has gone up to. And you'll be shocked about what has happened to poverty. I mean, we have no choice but to change our ideology. No choice. No, there's no question of remaining within your ideology. What is the poor person who's dying of hunger or is dying because he doesn't have enough money to have his child or his wife treated in hospital? And what are you doing? You're actually providing a massive guarantee for the private sector to expand as it is. And your public sector expansion in the health sector is not happening. Why? Where is the basis? And honestly, if the government is telling us that we'll be able to vaccinate most of the population by the end of this year, you should listen to the estimate. I've estimated this, that if you vaccinate people at the May rate, the average of the vaccination rate, daily rate of May, you will be able to vaccinate our entire population of 940 million people with two jabs by late 2023. If you double the May rate, and the May rate was about 2 million, by the way, per day. If you double the May rate, you will be able to do it by late 2022. And if you triple the May rate, you will be able to do it by about March 22. And in all of this, there are huge variations between the states. In the first variant, UP will vaccinate all its entire eligible population by 2025. How many waves would we have had by then? How many more would have died by then? How many would have been impoverished by then? Is anyone asking these questions? There have already been delays by the government by put in place a vaccine policy, to place vaccine orders, and now it has a vaccine strategy, a vaccine procurement policy, which has been contrary to what the national vaccine policy has been of 2011. It is contrary to what the vaccine policy of this country has been for 40 years. Central procurement and jabs by the state governments. The private sector buys when it's necessary. At this juncture, in a once-in-a-century pandemic, we've allowed 25% to be allocated to the private sector. On what basis? And on dual pricing system?
Okay.
I mean, Odisha chief, I'm finishing.
Yes.
Odisha chief minister yesterday said that no more than 5% should be for the private corporates. 95% should be procured by the central government. And I would endorse that completely.
In fact, Tamil Nadu Chief Minister has also written on same lines to the Prime Minister, saying you're giving way too much to the private sector. They're not even using up as much of their allocation. Instead, divert that to the central government and then the state governments. I understand the point that you're making, Professor Mehrotra, but from the May estimates, I think we've come a long way already. Still nowhere close to what we need to do on a daily basis to reach the target by December. One would need to do about 83 lakh vaccinations from here on to reach roughly the target that the government has by the end of the year. But what we have seen is the last 1 week since the new policy came into implementation, we have averaged about 59 lakh doses per day. So from the May average, we are already more than double. We obviously need to see if this can be sustained, and if hopefully they can actually step it up once more brands come into, and I think that's what the government is banking on, and so is the industry. Mr. Mukesh Gupta, is that your only hope now, if the government doesn't seem to be giving you any other stimulus right now, that you only hope that we get more and more people vaccinated and the economy opens up and you find your own way then?
No, I'm
another channel.
I'm very positive, in fact, and perhaps the government is doing its best as far as the vaccination is concerned. So what we were talking about when this COVID started, is, in fact, we were talking about that there will be situation when dead bodies will be lying on the road. There will be no treatment. What happens ultimately? Perhaps the government has managed this pandemic very nicely. There were some days, in fact, when the oxygen problem was there. But otherwise, what we have seen, in fact, what we were talking about, what has happened, in fact, you see the health issues, you see the economy also, the GST numbers and all those things. And now on your screen is, it is displaying that more than 6,30,000 micro enterprises are there. Government has come up with, scheme of micro enterprises now through MFI. The biggest problem of MFI borrower was high rate of interest. Now the government has come up with the reduction in the rate of interest. I suppose these measures, and we have seen recently the Reserve Bank of India has also come up with many schemes. The restructuring scheme was announced recently by Reserve Bank of India. So to me, government is trying its best to to move the economy and to move the health sector also. See, we are on the verge of, every time the doctors are saying that the third wave, Delta is there, Delta plus is there, whatever is not there, in fact. So investment in these days in the cities which are not the metro cities, I suppose this is very much required these days. And I am confident and I am sure that whenever, new things will be required, the government will come up to support these MSMEs. The Reserve Bank of India will come up to support these MSMEs. Many things have happened, and many things have been announced, in fact, in past 1.5 year time, and many more to come, I feel that.
Okay, interesting that you say that, but I just want to quickly go back to what I was debating with Professor Mehrotra and ask Abantika if she wants to weigh in on the vaccination part of it as well. Abantika, a lot of the economy conversation also depends on how quickly we can provide a safety shield to our people. You speak to anybody from the industry side, they're all hoping that by December and at least, things begin to look up, because nothing else seems to be helping at this point.
So, already the government has revised its estimate. We had ministers and Niti Aayog member Dr. Paul, all of them saying that we will have 216 crore doses by December. Already in the Supreme Court affidavit, that is down to 137 crore. And now here's the thing. States have already been told that they'll get 12 crore vaccine doses in July, which means, and there is more or less consensus that unless we hit 1 crore vaccinations per day, we have no hope of really achieving any decent amount of protection for people. So if we have 12 crore doses in July, obviously 1 crore per day is ruled out in July. And also, even at 137 crore, it comes to about 27 crore doses per month. I just did that calculation, which means that even if we manage to use every single dose of the vaccine, we will not do 1 crore. And, depending on states, the vaccine wastage is anything between 10% to 30%. That's one thing. And here is the problem. See, this virus is mutating very fast. So when the first virus, the original Wuhan variant was there, the R, which is the measure of infectivity, that was something like 2.5 to 3, if I remember correctly. Now it's already up to 5 to 8, which means it's far more infectious. Now, what happens when R increases? When R increases, your population that you need to vaccinate to achieve herd immunity, that goes up. So originally it was about 67, 70%. Now it's already up to 85, 90% because of this increase in infectivity. So here's the problem. The more we delay vaccinations, the virus is mutating. It is fighting back. So the more we delay vaccinations, the more people we will need to vaccinate to achieve any decent amount of protection, in terms of herd immunity. That's number one. Second point is, a lot of us will be needing booster doses. It's
Correct.
not like the virus stops existing in December. There will be people who will start to need booster doses by January next year. So it's not like you will only have your remaining population to vaccinate. You will then have booster doses to give. Where will they come from? And we seem to be living in a sort of, I don't want to call it fool's paradise, but we seem to be somewhat deluding ourselves into thinking that if we sort of project everything as hunky-dory, it is going to be hunky-dory, but that's not the case. Vaccines don't come out of thin air, and we didn't do the requisite investments when they came. We're doing too little, too late, and we are on top of it. We are again doing number jugglery, even with our projections of vaccine doses.
So, in fact, let me add to what you said. The correction that the government has done in its number when they actually had to put it in writing to a court is because they actually left out all the calculations of vaccine brands which haven't got the approvals yet. So, all additional brands that they were banking on, they obviously didn't want to give that kind of a written assurance to the court to say, oh, we're definitely going to get over 200 crore doses, because some of those vaccines haven't even got the approvals or haven't even applied for approvals with our government, are still in trial stage, and hence the numbers come down to 135 crore very quickly from the 210 crore figure that we were looking at. Nevertheless, will all of this even come to the market, and even if you're able to vaccinate, how much of that will help the economy open up remains to be seen. We are trying to sound a lot more hopeful. I think the only segment that seems to be buying that is perhaps the stock market, but not necessarily those who are part of the real economy, not necessarily those who are part of the business segment. You heard the representatives from the travel and tourism industry, from the MSME industry, that giving out more loan guarantees and announcing more loan schemes will not necessarily help us now. It's too little too late. MSMEs also are not in a mood to take any more loans. They've already borrowed so much money. Their businesses are not making any money. At this point, nobody wants to risk by asking for more loans, even if the government says we will become the guarantors to those loans. Let's see if this actually helps in any way in providing relief to the industry. Completely out of time. A big thank you to all of the panelists for joining us on this conversation.